Hi, Mr. Ingram. It's good to see you. I just wondered if you had a second that we could discuss something that has burdened me and I know several throughout the state and country, the opioid epidemic, which I know that you play a big part in as the data collector. I also do quality improvement as a nurse for the Department of Defense, and recently have gotten a station back in Kentucky, where I'm from, Louisville, and the opioid epidemic has affected many people that I know, including my own sister, who is in prison and has lost 2 of her kids and had a baby in prison that she had to give up. So this is something that is important to me, and I just wondered if I could discuss a couple of ideas that I had for improving this process. I know Senate Bill 192, I'm familiar with that, and it's also known as the heroin bill, is in 2015 currently in effect, which focuses a lot on actions after individuals become addicted to opiates and, needle transfer program to get clean needles to prevent further, IV infections. Also, the increased availability of Narcan and the increased funds for treatment programs. I see a lot of individuals that are a part of the research that has went into the opioid epidemic. But one thing that I didn't notice was there was not a lot of nursing presence in there. And one of the recommendations that I would have would be to include nursing into the push. As we know, Joint Commission has passed new standards for 2018. They started January 1st that is attempting to battle the opioid epidemic as well. So although that will help, we are going to be watching physicians and individuals closer to decrease the use of prescription opioids. And in turn, that's only going to potentially increase the use of street drugs like heroin and synthetic fentanyl, which are the 2 largest drugs that individuals are addicted to and overdose on in the state of Kentucky. One of my recommendations would be to focus more on prevention instead of after the fact when individuals are already addicted. One of the ways that we could have nursing involved in this would be to go into the schools, train nurses on how to deal with these individuals in the hospital, not just in a mental health facility or an addiction facility. Train hospital nurses, primary care clinic nurses, case managers, and utilize nursing for, what it can contribute to this cause. One of the areas we need to focus on is kids in schools to prevent, further growth of this issue. So, we could get together with nursing educators and train these nurses to visit different schools throughout the state, city, counties, and I think that this would assist, for our future. We need to focus on the prevention of further the kids, are young when they're starting out on this. So just increasing funding for nurses to get this training as well would further assist the fight toward the opioid epidemic. If there's any further questions, you can contact me. Here's my email. Thank you.